Got conventional medicine? Welcome to the weekly Friday value video. Have you attended any of the classes or challenges taught by yours truly? If you haven't, I want to share a perspective that may be helpful, and if you have, it never hurts to hear something potentially beneficial more than once. Having been in the healthcare world for more than 3 decades now, I've seen many things that are not good occur in the lives of patients as well as my own family members. While I would definitely beg you to take me to the hospital if I broke my leg or got in a serious accident, because more veggies won't fix that, I have not developed a belief that the current medical model has much to offer in the way of improving my overall health or reducing my risk of a nursing home admission in my old age. Let's look at this logically. Conventional medicine tells us that our only options are early detection, or sometimes they call it prevention. We'll talk about that in a moment. Medications to manipulate those blood biomarkers, medical procedures supposedly to fix things or prevent things, and full-blown surgeries. Sometimes they can be life-saving, so let's not throw the baby out with the bathwater, but I want to move on. I want to ask you, do these things improve our health and keep us independent as long as we're above ground? Let's look at each of them just a little more closely. Early detection. It does not necessarily mean a longer lifespan or a higher quality of life in the years we have to live. It also doesn't necessarily prevent anything. Finding something early didn't prevent it. Now, here's a simple example: treating prediabetes with medications. This has not been shown in the data to prevent full-blown diabetes from happening and all the complications that come with it. However, a low-fat, whole food, plant-based diet has been shown to not only improve blood markers, but often reverse type 2 diabetes. I highly recommend Dr. Neal Barnard's book, Program for Reversing Diabetes. And there's even a delicious cookbook. You will not be munching on your backyard grass, I promise. Here's another example: taking statins to address cholesterol levels. These medications are not shown to lengthen life or reduce heart attacks or strokes by more than a few percentage points. Yet, a low-fat, whole food, plant-based diet is seen to improve blood biomarkers and reduce the risk of those events. I highly recommend Dr. Esselstyn's book, Prevent and Reverse Heart Disease. And there's also a cookbook. I think you see where I'm going with this. Moving on to procedures. All procedures carry risks. This is not to say you should never agree to a procedure, but many procedures are done to address a specific issue, and they don't address the underlying cause of the issue. This means that decline as you age remains a high risk if you're not addressing underlying causes of issues. An angioplasty to improve impaired circulatory vessels does not address the reason the impaired circulation occurred in the first place. And you have a whole body of blood vessels. What about those vessels that aren't receiving the procedure? I'll never forget a patient that I worked with many, many years ago who had clots block the circulation to her organs and limbs after a routine angioplasty. She almost died, but they were able to save her life. However, because of the result of those clots blocking circulation to her limbs, she lost both legs above the knees, her entire right hand, and all the fingers except her thumb and half her index finger on her left hand. She was only in her 40s, having a routine angioplasty. I expect I need to say no more as far as the misery she and her family endured. There is nothing routine about procedures. They all carry risks. Now, I'm not sharing this to scare you. I'm sharing this so that you can be informed. Moving on to surgeries. While total joint replacements can radically improve the quality of life for someone, it is very much dependent on their activity level and overall strength and fitness, whether or not they end up in a nursing home as they age. Of course, this can be said for anyone, regardless of joint replacements or not. Simple, routine orthopedic surgeries address specific issues, not the probable weakness and imbalance in the body as a whole that led to the issue. The bottom line is this: what conventional medicine offers does not make us fit and vital and productive in our 90s and beyond. Only we can do that. No one ever set a goal to end up in a nursing home. They often end up there by default, typically because they didn't work to prevent it from happening. So, real prevention: nourish your body for life to promote healthy circulation and fight inflammation. That's key. Real prevention: train for real life, training your body, ensuring you can move your body well in all three planes of motion and maintain good strength in your power source. That's key. Real prevention: be informed, understand the facts behind what reduces your risks. That's key. Ask questions, know your risks, know your benefits so you can make an informed decision with improved outcomes. You can battle and overcome the enemy of losing your independence as you age. You can radically reduce your risk of ending up in a nursing home. You do not have to be at the mercy of conventional medicine options. Question conventional medicine as a prevention choice to have lifelong well-being. I'll see you next week.